done with me, right?
You're done.
Here.
Thank you.
Okay.
Do you want to give your Melitta?
Yeah.
One in your pocket or one in your... No, because we're recording remotely here. No? It doesn't work? Okay, I want to introduce one of our star students, Melitta Johnson, who's going to be talking increasing the legal age to access tobacco products in introduction, and this will be a lead-in to Senator Hernandez's talk coming up shortly. Thank you, Melitta.
Thank you, Dr. Freeman. Good morning, everyone. I'm here to talk to you today about increasing the legal age to access tobacco use. And like he said, really just an introduction to Senator Hernandez's talk on his efforts to increase the minimum age. Okay, so smoking and tobacco use. A lot of progress has been made since the first Surgeon General's report in 1964 that really spoke to tobacco use as being a detrimental effect sort of on your health. You know, smoking is bad, but at the time we didn't really know that smoking is bad. And so even though we've had a lot of progress since 1964, where 1964, 42% of people in the United States smoked, right now, today, 18% of the folks in the United States smoke. We still see that tobacco use is the #1 cause of preventable death, where nearly 500,000 people per year die due to tobacco use, and over 45 million people in the United States still smoke today, with 3 million of them being, children, really, adolescents. So those who currently smoke, we've seen that 90% of the adult smokers who reported smoking started smoking before the age of 18. And that nearly 100% of the smokers who began smoking, they began smoking before the age of 26. So if we really want to tackle the issue of smoking cessation, we want to target a certain population. We can guess the population that would be. So increasing the legal age will likely prevent or delay initiation of tobacco use by adolescents. So we all know smoking kills. Smoking is bad. But did you know that smoking kills people in a disproportionate manner? Okay, so smoking kills more people than HIV, the use of illegal drugs, alcohol use, firearms, and motor vehicle accidents combined. And this is just a slide to illustrate the smoking by gender, by age, by education level, and ethnicity. So overall, men on average smoke more than women. By age, those who are between the ages of 18 to 44, smoke more on average than those who are older than 45. People who have lesser education, so those who haven't graduated from high school and those who have earned a GED smoke more on average than those who have completed high school, those who have an undergraduate degree, and those who have graduate level education. And then by ethnicity, we see that our Native American population smokes more on average than the other populations. And this is also just a breakdown in LA County, which sort of mirrors the general population in the United States. So the cost of smoking and tobacco use. So the tobacco industries they spend billions of dollars annually on advertisements and promotion. In 2013, they spent more than $9 billion. So that equates to about $25 million per day on telling people, smoking is good, it's cool to smoke, you should smoke. But we fit the bill. In 2013, we spent more than $300 billion in direct and indirect medical costs. That's a lot of money. Smoking in the body. You know that smoking can cause cancer, it causes lung disease, infertility, so many different things. So, we ask the question, why are we smoking? Why do we still smoke? Well, social pressure, peer pressure, social reward. Sometimes we see our parents, our uncles, our aunts, our big brothers and sisters. We see these people smoking. We think it's cool to smoke. Marketing from the tobacco firm, stress, and then addiction, like Dr. Fowler just discussed. So the FDA and the Institute of Medicine thought that this is, still a very relevant and important issue. So earlier this year, in March of 2015, they took a look at the public health risks of smoking and tried to figure out ways that we could decrease the amount of smoking, decrease initiation rates, and really just take a closer look at the public health effects of increasing the age of smoking. And tobacco use, of course. So the Institute of Medicine had identified some key predictors for public health outcomes and looked at tobacco use initiation, developmental biology and psychology, and then also tobacco policy. So when taking a closer look at tobacco use initiation, we have to also consider what's going on in the adolescent and young adult brain. So the prefrontal cortex is sort of the executive decision maker, the part of the brain that's responsible for impulse control, cessation seeking, peer pressure susceptibility, and then emotional control, right? And so the prefrontal cortex fully develops after adolescence around, typically around the age of 25 to 30. So tobacco initiation primarily affects adolescents and young adults because their ability to make sound decisions and control peer pressure influences has not yet fully developed. And so how do we reduce the use of tobacco use initiation? Well, this includes but is not limited to, number one, continued tobacco cessation efforts at the city, state, county, and state level, increasing advertisements regarding cessation, discouraging the use of tobacco, partnerships with cancer societies, and then also raising the minimum age from 18 to 21, where we would see that adolescents between the ages of 15 to 17 will be most impacted because that's the population that will be able to get their tobacco products from their friends who are like 18, friends at school, high school, other folks, kids who have access to tobacco products. Tobacco policy. So like I said, states and local municipalities have the power to control the age of tobacco use. We had a success earlier this year, actually in June, where Hawaii became the first state to increase the minimum age from 18 to 21, which will be effective in January of 2016. And at least 80 localities in 8 states already have increased the minimum age to 21, including New York City. And just in conclusion, raising the legal age for tobacco use will save lives by 1, reducing the rate of initiation, and 2, reducing the number of tobacco users. State and local governments have the power and authority to increase the legal age to access tobacco products. And in terms of public health, the public health impact will depend on state and local initiatives that lead to smoking cessation. I just want to leave you with this quote from the Philip Morris Company, where they quoted this about 30 years ago, and they understood who the target population was, okay? So raising the legal minimum age for the cigarette purchaser to 21 could gut our key adult market, which is 17 to 20, where we sell about 25 billion cigarettes and enjoy a 70% market share. So if the Philip Morris Company understands who their target population is, so should we. Thank you.
Great job, Melitta. We'll have the questions after Senator Hernandez's talk combined. We now are very pleased to introduce Senator Ed Hernandez. And I'm not going to give long introductions. Everybody's introduction is in the bio sketches. Dr. Senator Hernandez has a very touching bio sketch. I encourage everybody to read it. But he's one of our true heroes, and we're really excited to hear about his legislative efforts to raise the minimum age to 21. Thank you.
Well, good morning. Thank you very much for allowing me to set some time with you. My understanding is students, community activists, and is that correct? I want to make sure I
Fine, I know you like to start talking. You can sort of talk into the computer so they can see you. Okay. And we're doing it remotely also.
I can do that. Okay. And you can hear me okay, correct? What I wanted to do, and my understanding is today's seminar is your 10th annual, is that correct? Yeah. And we've had a lot of scientific papers presented, great presentation with regard to changing the age to 21. I wanted to talk to you a little bit about the political aspect of it and the difficulties, but more importantly, the bill that I've introduced in the legislature to change that to 21. But before I do so, I first wanted to kind of tell you who I am in regard to within the legislature and my role and how I came about to introducing this piece of legislation. So I served in the 22nd Senate District. It's in the eastern part of the San Gabriel Valley. I just got elected to my second term in the California State Senate. For those of you who don't know, we have 40 state senators. We represent just under 1 million individuals, each one of us, because it's based in by population spoken of individually. California, as you know, is the 7th largest economy in the world. Most of the time, what happens in California kind of translates throughout the entire country. Everything from, in the environmental issues. So there's a lot of things that come out of California. But saying that, being the 7th largest economy in the world and all the business that's in front of the state, it's also a very difficult political process to maneuver through. So I am chair of the Senate Health Committee, which means I have had the pleasure of being involved with all of the health issues regarding the state of California since I was first elected to the Senate, but more importantly, have been involved with some of the biggest pieces of legislation that have affected healthcare in this country. So with the implementation of the Affordable Care Act, which we all know is extremely, or has been extremely controversial. From the day it was signed by President Obama, it was immediately challenged in the courts twice. The Supreme Court found it constitutional. Even if you saw last night's presidential debate, it's still a hot political debate. Now, keep in mind that the implementation of this act, in my opinion, is the absolute most important thing that has occurred in healthcare in this country. More so than even in the 1960s, when President Johnson signed Medicare and Medicaid, because that was only dealing with the poor and the elderly. Now we're covering everybody within the country. So the reason why I wanted to give you that little brief history is because I want to tell you what California has done, and then that's going to lead into my bill about raising the smoking age to 21. So California has been in the forefront of the country. First, to have an exchange, which means we buy on behalf of the consumer. Cover California has been doing incredible amounts of keeping cost control down. California was the first state to expand Medicaid. A third of the population right now, the residents are under Medi-Cal. We're drawing down federal dollars. The budget for Medi-Cal in this state is about $90 billion a year. It's a huge endeavor that we are now ensuring. We are the first state, we have the 10 essential health benefits. And because we are so successful, it's leading the country with regard to the implementation. I believe that California, its success is going to be the success of what's happening in the country. So I've had the honor of either introducing bills, dealing with the policy as they come to the committee. But there's several things that I think are very, very important. Number one is we have to make sure that everyone has access to health care. There's enough providers. But more importantly, how do we control healthcare costs, and how do we make sure that outcomes for individuals, we have better outcomes, but more importantly, how do we make sure that people stay healthy? Well, if you look at the biggest cost drivers that we have in this country in healthcare, it's very, very easy to figure out what they are. Obviously, it's diabetes, high blood pressure. But what is one of the biggest cost drivers? It's what happens when individuals get addicted to nicotine and start smoking. We can go anywhere from emphysema to heart attack to cancer. This is becoming one of the biggest cost drivers that we have in this country. So now I'm going to start talking a little bit about the political portion of it and about 2.5 years ago, 3 years ago, I looked at some of the biggest cost drivers, and I was thinking of introducing the bill to increase the age to 21, because looking at some of the studies that the National Institute of Health did, looking at what the different states are doing, I really felt I could make a huge impact on the state. So what we did is I reached out to all of the advocates, the typical advocate groups, the Cancer Society, the Heart and Lung, etc. Brought them in my office and said, look, and this is before Hawaii actually introduced the bill. This is what I'm interested in doing, because I obviously needed the advocates. And they were a little hesitant for me to introduce the bill then. And their priority at the time was to raise the tobacco tax in the state of California. I don't know if you know, but California has amongst one of the lowest tobacco taxes to do several things. Number one, to discourage smoking, but more importantly, bring more revenue in the state. So I held off on it, and the reason why is because I wanted to make sure I had the advocates. I said next year we're going to talk about it, which I brought it with us next year, and I said, Alan, look, I'm going to move this bill. And the timing was such that there's sort of becoming this coalition of entities that understand the importance of doing several things. Number one, increasing the tobacco tax, increasing the smoking age, but there's also another issue at hand, and I caught part of your presentation with regard to big tobacco, and that's vaping. Vaping is becoming a huge problem in this country, and especially in California. If you look at vaping, absolutely, I don't know if you've had any research on it or you've had any papers on it, there's absolutely no regulation with regard to vaping. You can purchase them anywhere. I see them in the 7-Elevens, in the grocery stores, in the gas stations, etc. And when you think about vaping, the argument is, well, it's just, it's a vapor. Well, yeah, there's this little device that they vape, but what it is, they vape nicotine. They can vape a lot of things. Obviously, they do marijuana, etc. But we all know that nicotine is very addictive. So the interesting thing about vaping is that at one time, the majority of the market was very, very small independent businesses that would sell the products, the actual cartridges and dispensing of the nicotine. Right now, 70% of the market is being bought up by guess who? Philip Morris, Big Tobacco, Altria. And the reason why is they see the trend of young adults moving to the vaping product. And the argument is, well, it weans them off cigarettes. It weans them off that horrible cigarette. Well, but it gets them addicted to tobacco. I understand your topic here is about addiction. Well, we all know that nicotine is an addictive product. So, and I think that they see, and it was an interesting statistics that Philip Morris had with regard to their market, and they go after young adults. And I think this is the perfect way for them to go after if addicted to nicotine and potentially move on or keep them within that market. So politically this year, there's sort of been this kind of coalition of increasing the tobacco tax, increasing the smoking age, which I'm carrying, and then also looking at making vaping and vaping products and classifying them as a tobacco product, so they're under the same, you have to be 18, and my bill passed you to be 21, you have to get licensed, etc. And there was this movement, and we had a press conference at the beginning of the session, we introduced the bill, and most of all the bills were started in the Senate. And for those of you know, we have two houses, we have the Senate, and we have the Assembly, and they moved very quickly without any problem through the Senate for a couple reasons. So the process that we go through, they have to go through a various committee structure. And there's what's called a policy committee, and then there's what's called a fiscal committee, and it goes to the floor for a vote before it goes to the other house. Well, being the chair of the health committee, I requested that all those bills go through the health committee because I believe they have effect on consumers in the state of California. But traditionally, the vices, we call them alcohol, tobacco, horse racing, etc., goes to another committee called governmental organizations. So I requested them, and the Senate side, they went through the health committee. And they got out onto the floor, they got voted out, they went to the other house. Here's where we ran into problems. We ran into problems on the Assembly side because they were requested by the chair of the Governmental Organization Committee, the GEO Committee. Now, the hard reality about politics in this country, whether we like it or not, large money plays a big influence in what we do and how we govern in this country and this state. And guess what? There's a lot of contributions made to members and the chairs. And I'm not saying that one leads to the other, but unfortunately, all the bills ran into problems in the assembly side. Mark Leno, I don't know if you're familiar with him, he ran the vaping bill, and my bill was going to be up later on that afternoon, but I did the vote count. I knew it was clearly not going to happen. They essentially gutted his bill, eviscerated it, changed it to something different. I chose not to hear my bill because I knew I was going to get the same outcome, and figured I'll just come back next year and try it again, because I felt that if we got out of that committee, we'd at least have a shot on the floor for a couple of reasons. Number one, there's a recent poll that shows within the country that, at least for with regard to changing to 21, that they believe, I think it's like in the high 70s, that they support changing to 21. There was a great study that just came out. I don't know if you guys went over it with the Institution of Health. They did various age groups. I think they looked at 19, 21, and 25, and they found the most effective age to reduce smoking for young adults was 21. And why 21? Well, if it's 18 right now, you are more likely within your social sphere to have a friend that is 15, 16, 17. And those individuals are more likely to purchase cigarettes for that individual. Whereas if you're 21, you're less likely to be socially active or involved with a 17 or 18, or 15 or 16 or 17-year-old. And therefore, I think the Institute of Health found that there was a significant decrease initially of young adults purchasing, getting addicted. And then if you look at the consequences long-term, the amount of money we're going to save in our healthcare system is in the billions of dollars, because you're having that less people that are going to get addicted to tobacco use, etc. So it was the perfect, and the 25 also was good, but the most optimal age was 21. So let's talk about what happens politically with issues. If you look at issues like global warming, now more and more states are starting to look at marriage equality. I mean, 20 years ago it was a very difficult political discussion, but it's kind of moved in the forefront in the country. California has obviously led the way. Tobacco, the same thing. You're starting to see small municipalities within the states, counties. New York was mentioned. Hawaii was the first state to actually pass the law statewide. So you're starting to see a political momentum that the public is realizing the effects of tobacco and either increasing the tobacco tax and or the age, but more importantly, bringing to light what vaping and the vaping product does. But again, when we're talking about raising the tobacco tax, I mean, you have to also make sure you don't go too far, because if you raise it so high, then it kind of goes in the underground and becomes a black market issue. But California definitely needs to increase its tax on tobacco. So, I was disappointed. This was a tough political loss, but I knew that was kind of the environment I kind of worked in. But then we were given a gift. And what I mean by given a gift, how many of you are aware that right now the state of California, the governor has called a special session? Any of you heard about that? Read it in the paper? No. So we have always traditionally had some tough economic or budget battles, and the governor's made it very clear what he's willing to spend and not spend. And then there's been some issues that haven't been addressed in the budget. There's been mainly two issues. One on the transportation side, and I know I'm talking kind of politics overall, but I needed to explain why we're going into special session and why it was a gift to us with regard to the tobacco issue. So with transportation, all of us know we have horrible infrastructure. Freeways, roads, and how many of you drive on the freeway and it's good luck. And the other issue is healthcare, the development of disabled, being underfunded, Medi-Cal reimbursement rates, IHHS, all of that. So the governor said, and realizing it's important, but knows that there's not enough money to take care of those issues through the general fund, so he called a special session for two areas. One for transportation and one for Health and Human Services, and wants us to find additional sources of revenue to pay for those entities. So why is it a gift? Well, it's a gift because now we run essentially another legislature concurrently with the current legislature. I was appointed as chair of the Health Committee, and because the special session only deals with health on the Assembly and the Senate side, and we got the green light from the governor, guess what? It only goes to one committee in both houses. It goes to the Assembly and the Senate Health Committee. It goes to the appropriations, and then it goes to the floor, and therefore we're going to completely bypass the Assembly Governmental Organization Committee. Now that doesn't mean that there's not going to be a hard-fought battle on behalf of tobacco, that they're going to, lobby members, etc. But I honestly believe, and I'm extremely optimistic, that I think we're going to have a decent shot of getting it on the floor and having a discussion and a policy debate about three things. A tobacco tax, because if we get a tobacco tax, we can use that money to offset smoking cessation, increase rates for providers to support people, make sure we have providers going to communities of color, deal with IHHS, but also deal with the developmentally disabled community as well. And right now, there is a willingness with the legislature to increase that tobacco tax. The second thing is changing the smoking age from 18 to 21. And third, and there's a series of bills that are out there as well, is also looking at making sure that vaping or a vaping product is categorized as a tobacco product. So we're on break right now, legislative break. I go back a week from tomorrow or Monday, and we hit it really hard for 5 weeks. And so I would encourage all of you to read the newspaper, because hopefully you'll see, knock on wood, I hope it's wood, that very soon we will put some bills in the governor's desk, and we will get signed some tobacco legislation that will deal with all the issues we just talked about. So my talk this morning was more of kind of laying out the political dynamics of what's going on. Obviously, it's not a scientific. I'm not going to have a PowerPoint. I'm not going to talk to you. I'd be speaking to the choir because I'm assuming all of you understand and know the science behind it, etc. But at this time, I'd love to open it up for any questions that anybody has.
Great presentation. Thank you. Let me start off with the first question is, what can us in the audience do to help support you and, not just reading the paper, but should we start calling people, lobbying? I think everybody, is everybody on board with this idea? No,
come on, all of us, yes.
Nobody's working for Philip Morris in the audience here. So what can we do to help get this through?
Great answer. A lot of things. First of all, what's the young lady's name?
Melitta.
She did a great job. Maybe I'll call you up to Sacramento for part of the presentation while we're in the committee here. I mean, that's just one. And I will look to you for some statistics as well. But, here's the thing about being involved in the political process, and whether we like it or not, it affects all of us. And number one, I encourage all of you to be registered voters, go out and vote. Number two is make sure you know who your state assembly member and state senator is in your particular area. Either meet with them, send them a letter, send them an email, talk to them, tell them about the legislation, how you support it. When it goes to the committee, send letters to the various committees. If you want, go to the Capitol when they're doing the presentation, speak on the issue. When it gets to the governor's desk, if it does, send a letter to the governor. Do whatever you can to engage politically to make sure this happens. Yes. Right.
Another question. A couple of years ago, they stopped smoking. The inmates stopped smoking in LA County Jail. Was that a health issue or a safety issue?
I don't have the answer to that. I mean, we can find out. I'm assuming it's probably both. It's probably a health and a safety, because my guess is when they have cigarettes, they sell them and use it for them,
Actually, if it's a health issue, then it's just trying to get some evidence about people with there being more healthier.
Yeah, I don't have the answer for you on that one. Sorry.
Back there?
Just want to quickly ask if was there a special reason that Hawaii implemented the the age increase?
You know, obviously they must look at the policy. I think other states are starting to look at it as well. They just happen to be out the gate first and get it into the governor and get it signed. I think there's a question right there.
I have a question. So, let's say legislation passed, we're able, that willing to get the smoking age increase. What about medical, recreational marijuana smoking? Because right now, you know, kids can do that with a doctor's recommendation at 18. Right. And so, let's say you got these 21 tobacco products. Then what about marijuana? Is that something that you want to amend your bill with?
That would be very difficult to do for one main reason. The marijuana initiative was put on the ballot by the voters. In order to amend that, that means the voters have to amend it. So it's written into our Constitution. The only way we would be able to do it is the legislatures with a 2/3 vote, and that would be very, very difficult. I don't disagree with you, but it's just because it's into the voter initiative, that's what makes it very difficult.
All products.
Yeah, so I think while we're going over to candidates, I think the beauty of Senator Hernandez's bills include this sort of combination of the vaping, the e-cigarettes, and the age of tobacco. So it's all tobacco products we raise to 21. So, you know, not only cigarettes, but the vaping products, which the kids are using like crazy, some of them, you know, just stay with that, but many of them go on to cigarettes. So I think we're to try to stop both the vaping. It's the same thing that they can't, they have friends that are 18 that buys the vaping products for them that will stop. But I think also tied into that is you can go on Blue Cig website and the question is, are you over 18? You say yes, you can buy your e-cigs on their website. So I think the laws have to be stronger, and I think the 21 is a perfect age to really you know, divide between true adults that, you know, I guess are responsible to make their own decisions and children whose brains are developing and things like that. Candace?
Has there been any talk in the telecommunications chair or anywhere else within the legislature or Senate regarding legalization of marijuana?
There has always been a lot of discussion, and because the voters approved municipal marijuana, there's a lot of patchwork of regulations throughout cities, counties, etc. So the legislature has done numerous bills to try to make some kind of standardization. And there's like 3 bills running through right now that I think there's going to be some kind of resolution. And because the voters approved it, we have to allow it within the state.
I was referring to recreational marijuana, like Colorado, Washington,
there's
for tax purposes.
Not in the legislature that I've seen, but I know that there will probably most likely be an initiative at 16 because of everything that's occurred in the other states. And 16 is the perfect time to have it because of presidential election, high voter turnout, the higher likelihood of it passing. So I wouldn't be surprised, but it's not going to come out of the legislature. And the problem with it being written through initiatives, you have no idea where that money is going to go. Because if they write it that it goes to, I don't know, local government, or if they and they may write it when they're not even have that tax money. So that's what makes difficulty with regard to initiative possible.
Questions from remote people? Tanya and Cynthia, do you want to comment a little bit on this as a prelude to your next talk, or you just wait to your next talk? Okay. Any other comments?
Well, thank you very much for having me. I appreciate it.
So that was a great talk, and I really admire your work. Let's hope these pass. Are you thinking about 5 weeks where we should be hearing something? Okay, super. Thank you so much. Thank you. So we'll have a break until 10:40. Please come back by then.